Most men underestimate just how much influence their hands can have on a woman's pleasure. With the right approach, fingers alone are capable of bringing some women to orgasm. The reason is simple: fingers are flexible. They can bend, adjust their angle, change pressure, and move in ways no rigid object can. That versatility makes them extremely precise tools when used with patience and care. I'm Dr. Catherine Mitchell, a men's sexual health specialist, and in this guide, I'll walk you through a respectful, step-by-step method of using your hands so that your partner feels comfortable, valued, and deeply satisfied. The first essentials are always consent and preparation. Consent means asking openly, "Do you want me to touch you here?" and continuing to check in throughout. Preparation means trimming and smoothing your nails, washing your hands thoroughly with warm water and soak, scrubbing under the nails, and removing rings or jewelry. Keep a plain water-based lubricant nearby. Clean hands lower the risk of micro tears and infections, while lubricant ensures smoother, more pleasurable touch without unwanted friction. Female arousal is rarely instant. It's a gradual process involving the whole body. Start away from the genitals. Kiss her lips, neck, collarbone, and arms, then trace your hands down her back and outer thighs. As you move inward toward her inner thighs, slow down. With clothing still on, place your palm lightly over her vulva for a moment before lifting away, or outline the edge of her underwear fabric with your fingers. This teasing back and forth helps increase blood flow to the clitoris, labia, and vaginal opening, making them much more responsive later. Begin touching over the underwear and only shift to bare skin once she's comfortable with it. Outline her outer lips and thighs with your fingertips before moving gradually to the inner lips. Avoid direct clitoral contact at first. Instead, circle around the hood with delicate strokes. Small circles, gentle side-to-side motions, or oval patterns often work well. Pay attention to her signals, changes in breathing, the way her hips shift, or quiet sounds. Those cues tell you when you're on the right track. Every woman is different, but most respond best to steady, consistent patterns rather than random movements. Try circling slowly around the clitoral hood from top to bottom, or trace figure eights. If she prefers more surface coverage, use 2 fingers together. If she likes precision, stick with 1 fingertip. Keep checking in with brief questions, softer or firmer, faster or slower. Remember, natural wetness doesn't always mean she's ready for penetration. Always ask, "Do you want me inside?" If she says yes, apply lubricant and begin with 1 finger. Never insert dry. Glide in slowly and pause so her muscles can relax. A gentle "come here" motion toward the front wall is far more effective than fast thrusts. Explore by moving slightly up, down, left, and right. If she tenses, pause or return to external touch. About 1 to 2 inches inside, along the belly side wall, the tissue often feels spongy. This area, sometimes called the G-spot region, becomes more pronounced with arousal. Curl your fingertip toward it with a slow beckoning motion, starting light and only adding pressure if she asks or her body leans into it. Many women enjoy repeated, steady strokes rather than intense ones. Meanwhile, your other hand can caress her hip, stroke her stomach, or stimulate the clitoris with your thumb. This combination of internal and external touch can be especially powerful. If she wants more fullness, you can slowly introduce 2 lubricated fingers, keeping them curved toward the front wall. Inside, use small arcs or "come here" motions while your other hand continues clitoral stimulation. Small, controlled movements are usually more effective than large ones. As her arousal rises, consistency matters far more than speed or strength. When she gets close to orgasm, her signals, hips pushing toward you, quickened breathing, louder sounds, trembling legs, will become stronger. Once you've found the rhythm she loves, don't change it. If she says right there, hold that exact pattern until she finishes. Many orgasms are lost because stimulation shifted too soon. There are also some variations many women enjoy. You can slide 2 fingers in a V shape along the clitoral hood without exposing it directly, creating gentle gliding sensations. You might move in an outer to inner wave, starting at the thighs, then the labia, before returning outward. This resets sensitivity. Resting your palm warmly over the vulva with gentle pressure can also calm her between peaks. Adjusting her angle with a pillow under the hips can make the front wall easier to reach. Always keep nails short, hands clean, and use lubricant generously. If you move from anal to vaginal play, wash thoroughly or change gloves. If she feels any burning or sharp pain, stop immediately, add more lubricant, or return to external touch. Warm stretching may be acceptable, but only if she says so. After orgasm, continue gentle touching, but lower the intensity as her body relaxes. Many women enjoy being held, having their ribs stroked, or their hair caressed. A light belly or thigh massage can also be soothing. Offer her a glass of water and later ask one simple question: what did you like most? That feedback is more valuable than any guide because it's tailored to her. Not all women orgasm from penetration, and that's completely normal. Many prefer clitoral stimulation alone, while others enjoy a blend. The only way to know is by asking, listening, and observing. Finally, remember that emotions matter as much as technique. When a woman feels secure, admired, and unrushed, her body responds with better blood flow, relaxed muscles, and increased pleasure. With patience, sensitivity, and care, your hands can become remarkable instruments of intimacy. If you found this guide valuable, consider subscribing and sharing it with others who appreciate respectful intimacy advice. And for men who want to support their own sexual performance, certain natural supplements may help. Watermelon extract, rich in citrulline, can support circulation and nitric oxide. Some advanced blends that combine tongadali, fenugreek, nettle, and citrulline are also designed to aid erections, stamina, testosterone, and prostate health.